Hello friends, this is going to be a comprehensive lecture and we will be talking about how do we approach the MRCPCH clinical exam history taking station. So without further ado, let's dive in and get started. Okay, so the first thing that you need to know is that this station is a 22-minute station. When you are in your exams, they call them circuits. So usually there's a morning circuit and there's an evening circuit. I think in every circuit there are 12 candidates. So usually there are two history stations. Each station is different. It's not like that you have to appear in two history stations, you have to appear in one, but they're usually coded as red and blue. So you would either go into the red history station or either go into the blue history station, but they are different. So you will be just allocated one of them. So it's a 22-minute station. In this 22 minutes, you have got 10 minutes for your history taking, 3 minutes for presenting that history taking, and then after that you will be having 9 minutes where the examiner would be having a discussion with you, would be asking different questions and maybe looking into how do you prepare your management plan. Now this history station is usually a scenario based. So before you enter this station and you have got these 22 minutes, you will be given a paper in which there is a paragraph of short history about a patient. You have to read that, and then based on that history you have to based on that like scenario, you have to take your history in the next 10 minutes, and then you proceed with the examiners. Now, because history is usually based on some symptoms, if you read those paragraphs, you will see that it can include any symptom. But for the last couple of years, you will see that the common symptoms on which the scenarios are based are either fever. So there will be a scenario in which a child of any age is presenting with fever. That fever might be associated with some background, like for example, he might be suffering from some cancerous disorder, or he might be having an acute fever, or he might be having a chronic fever. The main symptom might include vomiting. It may include diarrhea. It may include different types of painful scenarios where, like for example, they might be having abdominal pain, chest pain, back pain, headache, things like that. And some of the other common symptoms that are usually assessed in these history stations are cough, seizures, headache, etc. So remember, but the list is a very exhaustive one. There could be any symptom that can be given in the form of a scenario, but nevertheless these are some of the symptoms which are commonly asked, and you should have a very thorough preparation of these things. So you should be very familiar with these symptoms. You should have practiced a lot about these symptoms, so like you go in a flow. Okay, moving ahead. So once you enter the station, what you will do is you will introduce yourself. So say I'm Dr. this and this. You hand over, you've got a candidate sheet in which you have got your candidate number. You immediately hand it over to the examiner. It's basically, I mean, you're not supposed to do this, but it's good that you greet, you say good morning, shake hand with the examiner, and then when he says proceed and please take the history. So greet and shake hands with the patient, carer, or the parent, because this is usually scenario based. Patients are not there, there will be a role player. So with a gentle smile or professional smile, introduce yourself and shake hands, say hello, because usually the name is given in the scenario. So say Mrs. X or Y, my name is Dr. ABC, one of the pediatric doctors. I'm here to talk about your child's symptoms. So let's see these types of things. So this way, when you are introducing yourself and you give a sort of an opening statement that I'm here to help you, or help to know more about your child's symptoms, and these types of things. So that helps you in establish a rapport. So with smile and these things, you are on a good start. Once you have introduced yourself, then again, obviously you have read the scenario and that would be fresh in your mind. So simply ask the parent or the carer to tell you more about the symptoms. Always go with an open-ended statement rather than you saying, okay, when did it start? And because when you've been taught about history taking, that how to take history, when and for how long, things like that. Well, I mean, you will be doing that, but to begin with open-ended step. Okay, like scenario said, a child has got a fever for the last 5 days. He's got a background of, let's say, juvenile idiopathic arthritis. We'll say, okay, ma'am, I have heard that your child has got GI and is now presenting with fever. So you say, yes, oh, please tell me more about it. So start like it with an open-ended statement, and obviously she would say something. So have this there is a temptation to interrupt and ask further, as they are talking, okay, when did it start? Just let them talk. Let them go with the first opening statement, whatever they want to say. Just read and make some mental notes. So in that thing, there might be some information which you are planning to ask, but the mom herself gives the opening statement. Like, she might tell you for how long the symptoms have been there, how it has been progressing, what she has done so far. So there is usually a temptation to interrupt them and ask, but hold back, hold your horses, just listen, take mental notes. Or if you've got a pen or piece of paper, you can just quickly scribble as well. But remember, I'm not a big fan of scribbling, because sometimes you then just you're focusing more on that, less on the listening, and then you are lost. So just start with an open-ended statement. Fine. Then once the opening statement has been given, then you take your further history in this format, which is abbreviated with ODISPARAM format. Okay, so ODISPARAM actually stands for a few things, and you should be having this mental flow in in your mind, where you should just carry on according to this format, like starting from O and ending it up. And so what does O say? Onset. It also means, okay, fever. Okay, when did the fever start? What were the circumstances in which fever or cough or whatever that is presenting it started? Okay, so onset, like, was it acute, sudden, was it like gradual over a period of time, things like that. Okay, and what was the scenario? Like, they say, okay, they went outside to fast food, and when they came back within a couple of hours, the child started throwing up. So like, what were the circumstances in which it started? Like, for example, they went somewhere from where it started, so you think, oh, maybe it might be food poisoning, or maybe something like viral gastroenteritis, things like that. Duration of the symptoms. The D stands for duration, for how long the symptom have been going: 1 day, 2 day, 3 day, couple of hours, etc., etc. Intensity means how bad the symptoms are. Like, for example, if it is fever, whether it's a mild fever, okay, he just feels hot to touch, but there's nothing else. Or like, oh, he was boiling hot, he was hot to touch, the temperature was like through the roof, 40, 41. So intensity of the symptoms, like how strong or how bad the symptoms are. Special attributes of the symptom. Every symptom might have some special attribute. Like, for example, if you are talking about vomiting, so vomiting obviously has got a few attributes which are actually confined to vomiting. You don't ask those things in case of cough, for example, vomiting. So you ask, okay, frequency, color, consistency. You ask about the red flags in vomiting, whether it's like, whether it contains any blood, whether it contains any bile, green color, red color, black color. You would be asking about whether it has got any relation with the foods. Okay, things like this. More during the day, more during the night. So whether it's associated with nausea or without nausea. So these are special attributes of a symptom. With cough, you would be asking whether it's a dry cough, whether it's mucousy cough. Okay, what is the characteristic of cough? Does it more like a barking cough, or like of a like small, like toy gun firing sort of a cough? So special attributes of symptoms. Every symptom has got special attributes, and at least for some of the common symptoms like fever, vomiting, diarrhea, headaches, cough, you should be knowing what are the special attributes of these symptoms, and you should be remembering it on your fingertips. Then P stands for progression of the symptom. How the symptoms have been progressing, whether they've been static, whether they've been like slowly and gradually aggravating, or whether they've been improving. So progression of the symptoms is also very important to ask in the history, and that comes in the P of this format. Then aggravating and relieving factors. Okay, so what is making the symptoms worse, and what is helping them? In case of fever, they might ask, it's helped by paracetamol or ibuprofen. Aggravation, like anything that makes it worse, like walking or running, things like that. I mean, just ask. I mean, in fever, it's not the aggravating factor, not that much relevant, but in many other things they might be relevant, like for example in cough, diarrhea, etc., etc. And the final M stands for management so far. So how, ask them like, okay, fine, I can understand that fever has been going on and must be a hard time, but how you manage it so far, what you have done it for so far. Have you been to the doctor? Like, for example, have you tried to treat it with some home-based medication, things like that? So, and how they have responded. So this is important in when you are taking your history of present illness in this ODISPARAM format. So for fever, cough, vomiting, things like that, you have to ask every symptom in this ODISPARAM format. For some conditions which are associated with pain, like it could be abdominal pain, back pain, chest pain, headache, etc., etc., you have to take the history in the SOCRATES format. So this SOCRATES actually again is an acronym in S stands for a site of symptoms. So for example, if they've got pain, so where is the pain? Is it in chest, abdomen, back, etc., etc.? Onset of symptoms, again, and what were the circumstances in which it started, for how long it's been going on. Character of the symptoms. Character means how does that pain feel like? It's a dull pain, it's a sharp pain, it's a lightning pain, it's a somebody has stabbed them, like, these sort of things, which are known as characteristics of painful symptomatology. Radiation of the symptoms. You have to ask from where the pain is coming, if they feel like the pain is coming from severe or going somewhere. So that's radiation. Association, is it associated with something? Like, for example, if the pain is there, is it associated, like abdominal pain, is it associated with diarrhea, with constipation, with vomiting, etc., etc.? Time course of symptom is also important. Are the symptoms like continuous, or are they occurring at a special time of a day? Is it coming, like, for example, colic pain of the abdomen can come and go in waves, okay? So like the time course of the symptom, whether they are coming, and going, and like are they occurring at a special time of the day? What aggravates the pain, what relieves them, and what do you think about the severity of the symptoms? So it's very simple. In UK here, we usually ask, like, okay, if I have to ask you to rate the pain on a scale of 1 to 10, 1 being you're not bothered about it, and 10 being the worst pain of your life, how much marks would you give to your pain? So it's a standard question which, like, in painful conditions, in which you can get an idea of how severe the pain is. Then from history of present illness, you go to the past medical history. So in past medical history, ask about if they had, start with the colors, if they had these similar symptoms in the past, okay, have they got an chronic underlying problem? Now, usually in many history stations, usually they've got an underlying chronic issue. Like, for example, somebody coming with difficulty in breathing, he's a known case of cystic fibrosis, is under the cystic fibrosis clinic. So in that particular case, you will ask, okay, fine, I can understand he's got chronic, let's say he's got cystic fibrosis. Can you tell me when was he diagnosed with cystic fibrosis? So when that diagnosis was made, how that diagnosis was made, like whether there special tests or sort of procedures that were done to diagnose that case. You ask about whether he's under the specialty care, so whether he's under a pediatrician, whether he's in a specialist care team, and how frequent is he being, followed up by that team. So it's very important to ask these things in your MRCPCH clinical exam. You also ask about if he has been previously hospitalized for the same problem or for any other problem, and how that hospitalization was, like how bad it was, like what was the outcome of that hospitalization, whether he had any surgeries done, whether he had any procedures done, whether he had any blood transfusions, or let's say excess. So ask this thing in the past medical history. It doesn't take more than 2-3 minutes to. Then you go towards further back, birth and developmental histories. In birth history, very important for every child. You ask with the antenatal, whether this was a planned pregnancy or an unplanned one, okay, whether she had any infection, whether did she take any treatment. In antenatal, it's also very important in UK, because every woman has got, they undergo scans. So ask about if she had scans and everything, and anything was picked up on the scan. So they ask about that. Natal history, then you ask about whether this baby was born, was a term birth or a preterm birth, whether that was a cesarean section or normal, if it was a cesarean section, elective one or emergency one. If it is emergency one, what was the emergency? Then when the baby was born, did he stay in the NICU, or did he had any problems, like for example a low APGAR score, or needed some form of resuscitation, or needed to stay in, or had, like, antibiotics, things like that. Then you also about major developmental milestone. You don't need to take a developmental history, just simply ask at what time did the child started smiling, when did she start notice that he was sitting without support, when did he start crawling, when did he start walking, okay, and whether she's got any concerns about about vision, his hearing, language, and his social interaction, depending on the age of the child. So whether she's got any concerns, that's, you simply ask. You don't need because otherwise you will be just like wasting your time in the developmental history, and you've got a separate station where this developmental history is taken in detail. So just quickly, you have to ask about 2-3 major gross motor, and then for other things like fine motor, you just ask about vision, whether they've got any concerns or not. That's it. If they say concern, you will ask. If not, just like, you proceed. Then after that is a nutrition and sociocultural history. So you ask about how is the diet of the child. If the child is a small one, okay, whether he's been breastfed or bottle fed or mixed combination, when was the weaning started, has he got any special nutritional needs, whether he has got any, like let's say a PEG tube and he's on liquid diet, or he's got swallowing problems, things like that. You ask about immunization history. So very simple, that you just ask whether he is fully updated with his jabs for his age or not. If not, you ask the reason. Most of the kids in UK are immunized. Then you also ask about how many siblings again, as to whether they've got any problem, whether there is any problem in the family where kids they suffer from a particular type of infection. Just ask them. So if there is anything, they will tell you. You also ask about whether they are known to the social services, or if the child is like as an adolescent, whether he had any problems with the law and the society. For example, he's a naughty one, and he's a problematic child. And also you ask about whether they're known to the social service. That means like there are some domestic issues. You also ask about the child is school going, whether he's good in academics, or whether there is any problem in school, because some kids with the mental or developmental regression, that sort of things, can have academic issues. And you also ask about if he's a special needs child, for example, if he has got hearing problems, or if he has got a global sensory problem, things like that. So it might be special needs children who go to special school. So just ask about that. Then at the end, you ask about drug and allergy history. So you ask whether the child is taking any medications, and if he's taking any medication, you ask what medications are there, what dosage is he taking, and for how long he's been taking it. Whether he was on any medications for any reasons which he has stopped now. You ask about that, and you ask if the child is allergic to anything to best of their knowledge, or whether he has developed any sort of a reaction to something which he has taken, or whether he's got any, if not drug, you just ask about if he's got any dietary allergies as well, though usually that is covered in the nutritional history as well. This is the overall format of the history taking station. So because you've got only 10 minutes, okay, after 6 minutes they usually they press the bell, and you've got another 4 minutes. So within 6 minutes you should be focusing on history of present illness. In the last 4 minutes you have to go through the past medical history, developmental history, birth history, drug and allergy history, education, sociocultural history. And again, as I told you, these are quick screening questions that you ask, and usually I tell you, because they have planned these stations, usually it's not like you will say, okay, well, I might be stuck in sociocultural or that history. No, usually there is nothing in that. So it's quickly asking, screening, questioning, and passing by that, because most of the times there will be nothing. And final question is like, okay, what have you done so far, the management so far? And then one thing before you are closing that, they say, okay, what are your main concerns? Okay, in this I've asked about that thing. So what do you think, what is your main concern now about this presenter? So you say, oh, I'm worried that he might not be having sepsis with fever or things like that. Okay, I understand. So when the examiner tells you your 10 minutes are over, say thank you very much for your history taking. You'll be very helpful, okay, for giving this information, and that would help us in making further plans for your child. Then what would happen? The role player would go out of the room, and the examiner would say, okay, please present your history. So in that case, it's not like you start then, oh, well, just present your main finding that today, let's say Alexander's mom came in because she was worried that Alexander has been having fever for the last 5 days. Fever was of acute onset, mild grade, responding to paracetamol, associated with a bit of like dry cough, and on the 3rd day he developed a mild rash which spread from the chest down to the whole body. And in the past medical history, there's nothing of note. He's developmentally fine. There are no developmental concerns. There's nothing of note in his past medical history. In development, he was born full term, was a normal vaginal delivery with no postnatal complications. So far, he's been developing well. He hasn't had any past medical history of note, things like so. You just like, within 3 minutes, you just have to present. But the only important thing is if there are main things which you have noted, just present them, focus on that. And after that, the examiner would start asking you questions like, okay, well, fine, what do you think, what are your differential diagnoses, what further investigations would you like to do? And so in that particular case, again, if you have taken a good history taking, you should also know how to further work up that things. Like, for example, you would say, okay, I would like to do a complete physical examination, a general physical examination, a systemic examination, to see if I find any focus of infection, or if I don't find, let's say, depending on the severity of the condition, I might want to do a few blood tests. And then in my child, what blood test would you like to do? So for example, you can say I would do a full blood count to look at the white blood cell count and the neutrophils and lymphocytes count. I might want to do some inflammatory markers to see if what is the level of inflammation and things like that. Okay, or maybe if it is fever without any, I might want to do blood cultures to see if there is any form of bacteria growing in the blood, or might want to do a urine culture. So again, as I don't want to go into that, because this is all dependent on your theoretical knowledge of pediatrics, but I just wanted to focus on this history station. It has got good marks. So developmental station, these have got good marks. It's got 22 minutes, so 10 minutes is a good time to take a good history. And if you are well prepared and you know about the knowledge of theoretical pediatrics is good, probably you'll get full marks in this station. So this was all about how to approach the MRCPCH Clinical Examination station. Hope you've liked this video, and if you haven't subscribed to my channel, please do subscribe. Share this video with your friends, and if you have got any questions or you think like there are any queries, put your queries down in the comment section below. I'll be happy to answer your queries and questions. Have a very good day. Take care and bye-bye.